am a very health conscious person. I've always worked out, I've always been active, weights, things like that. And I prepare healthy meals at my home for my family for the most part. My children enjoy salads, so I've always been a very healthy individual. I've never had medications for anything in my life. I've never had a diagnosis for anything in my life. I've always been just picture perfect health. February 13th was a normal day. I was gearing up for a busy day the next day in my shop because it's Valentine's Day. And I climbed in bed about 9:30, and probably within 5 or 10 minutes of climbing in the bed, I immediately felt off. My heart started burning immediately. It was heavy and it was tight. And I kind of sat there, just kind of sat up in the bed and looked at my husband and said, something's not right. I just don't feel right. And it just didn't let up at all. It just got heavier, it got harder, it got tighter, it just didn't let up. And then probably maybe within 15 minutes, my left arm started going numb, and I immediately knew. I knew it was a check in my spirit. And so Josh is up, my husband, and he's pacing the floors at this point. He's got his shoes on and his ball cap on, and he's, let's go. And so I called my mom and I said, I think I'm having a heart attack. I need you to come over.
I had just gotten in bed. I had not even gone to sleep, and the phone rang. I thought it was pretty odd that she was calling me that time of the night because we don't usually talk that late. And I answered the phone, and she said, I need you. And I said, okay, well, what do you need? And she said, I think I'm having a heart attack, and Josh is going to take me to the emergency room. Can you come stay with the kids? I said, I'm on my way. Go. Please, get in the car and go.
I was on call one night and got called by the ER that a patient had come in, a younger female with chest pain, concerning for cardiac issues, but they did an EKG. It did show an acute heart attack, so we knew that this was real. As they were putting her on the cath table, I was asking her questions like I do, when I'm meeting other patients in an acute situation. And she did, tell me that her mother had heart disease as well.
Thanksgiving 2007, I was not feeling well, and the next day they got me in to see Dr. Reed Cotton at Jackson Heart, and he told me that I needed to have open heart surgery. I asked him, what if I didn't have this surgery? He was sitting on the foot of my bed, and Lindsay was sitting on the other side of my bed, and he looked over at her and he said, when's that baby due? And she looked at him and she said, end of May. And he looked at me and he said, you won't live to see that child.
It's really surreal whenever they tell you you're having a cardiac event. There was a lot of unanswered questions in my mind at that moment. Just what's going to happen? I'm laying there going, am I going to die? Am I going to see my kids again? No. I left him in the bed. And didn't tell him I left.
I don't think I even slept that night at all. Just for fear of what could have been happening. Was she going to live? Was she going to be here the next day? Was I going to see her again? And I think that was probably the hardest part for me. Was knowing I may not see her again.
We took her emergently to the catheterization lab. We got a wire past the blockage and opened up the flow, but you want to treat it with medicines. So you want to get the flow returned, but not leave a stent. Lindsay is now on medical therapy. She will see us regularly in clinic and we'll monitor her closely. She was already an active person, but obviously she's going to be, we're going to encourage that she stay on a very active exercise regimen. And if she ever has any change in symptoms whatsoever, she's going to have an even lower threshold to call me or one of her other doctors and let us know.
My days now, as far as activity, really kind of goes towards walking my dog. I've had to make a few lifestyle changes as far as caffeine and exercise and things, but that's okay. If I have to give that up and still see my kids another day, I'll give up coffee all day long. The American Heart Association does such great work around the country, educating women, providing resources for women.
They're not only there for research opportunity, but they're also there for support. they are there to provide ways to cope with heart disease, ways to help look at preventing heart disease. I think that is so important.
I'm very appreciative for the American Heart Association for raising awareness in the community. I appreciate all the people who donate money to the American Heart Association to raise awareness, but also to help with research so we can better take care of our patients to live longer and healthier lives.
I really just enjoy that slower pace of life. I think that I need a slower pace of life. Whenever you're 38 years old and healthy, you don't walk through life thinking about death. We're all busy, and so we spend our lives just thinking about what do we have to do today? What sport activity does my kid have this afternoon? And then whenever that happens, you kind of walk away from it going, that could have been my last day, or tomorrow could be my last day. And so you kind of look at life a little differently. I am thankful every day for another day.